All right, it is 11:01, and I know we have a packed agenda, so we're going to go ahead and get started. Thank you all for being here today. We're starting off the new year of our community stakeholder meeting. I truly appreciate you all being here today. I know that we have so many things on our dockets these days and so many meetings and different things that are going on. And we really do appreciate you taking the time to be with us today. All right, next slide, please. Oh, also, I want to say thank you to the team that we have here today. So it's myself, Dahlia, and Dot. We work together in order to make sure that we're able to bring to you these wonderful meetings and have these fantastic speakers. So we want to thank them for all the work that they do. All right, so today our agenda will be, next slide, please. All right, we're going to do our welcome and introductions, our two presentations, first starting with our Community Partner Spotlight, which is the Virginia Community Health Worker Association with Shantini and Stephanie. And then we'll have a presentation on our 12-month children's continuous coverage that went into effect January 1st with the Eligibility Policy and Outreach Division Director, Sarah Cariana. And then we'll wrap it up, taking the announcements, and then also think through how can we make sure we're better serving you. All right, next slide, please. All right, thank you. Next slide. So I've already said my welcome to you today, but we want to know who is in the room. We want to know who's here with us today. If you can drop in the chat your name, position, organization, and if you registered, we got a lot of that information, but we're always still good to know. Other people are always happy to know who's here. And then I would love for you to say and let us know if you could swap lives with any fictional character, who would it be and why? And as of late, I was thinking to myself, I would love to go. I'm going to my sister's wedding soon, but just explore. So I was talking to my niece the other day, and we were imagining if our lives were the lives of Dora the Explorer, what would that look like? And we talked about it in depth. Like, it was such a great conversation to have with an 8-year-old. But we talked about being Dora the Explorer and where we would go and all the things we would do and all the animals we would talk to. So if you could drop in the chat, if you could be any fictional character, who would that be? And as we're going through introductions of our panelists today, I would love for them to answer that question as well. So if you could each introduce yourselves, let's start with Shantini and let us know who would that character be and why.
All right. Thank you so much, Natalie. It's an honor to be here. And so I was thinking deeply, and I could only come up with the fictional character that has been always my inspiration, and that was Superwoman, Wonder Woman, and that is because she always had so many tools at hand. She had her rope, and that would help her.
A lasso of truth, yeah.
Yes, and then that will help her catch the bandits and get them to tell the truth. And that is so important. And so that stayed in my mind. We, as leaders, community leaders, have to have our toolbox available for community members so that we will be able to bridge their needs. So I see myself kind of sort of in that realm. So I'll pass it back to you or my colleague, Stephanie Carrington.
Stephanie, and don't forget to tell us what role you play, because Shantini is the she forgot to tell us who she is.
I apologize. Shantini Jackson, Executive Director for the Virginia Community Health Worker Association. I also identify as a promotora de salud, which is the Latino version of a community health worker. And recently, I actually attained my doula certification. So I'm a certified doula. Thank you so much, Natalie.
Thank you, Natalie. My name is Stephanie Carrington. I am the president of the Virginia Community Health Worker Association Board. And I'm also a certified community health worker. If I could swap lives with any fictional character, so you and Shantini are going to have me switching my answer. You have great answers. But I said Mickey Mouse or Minnie Mouse because they're well loved and they've been here forever. So I think I would be Mickey or Minnie.
Excellent. And last, I don't know if Sarah's available. She was overlapping a little bit, but Sarah, are you available to introduce yourself? She may not be. Okay, we'll come
There
back.
we go. Sorry, took
Oh,
me a
there she
second.
goes.
Sarah Cariano, I'm the Director of Eligibility Policy and Outreach here at DMAS. I don't have an answer for this. I'm so sorry. I'm like, my brain is just like, I don't know. But maybe by the time I present, I'll come up with a good one and I'll throw it in there. Nice to meet y'all.
You as well. And I see some good ones in the chat.
Right?
I see Emily was like Bones from and I love Bones. Bones was both smart and direct. I really enjoyed her. I definitely see, let's see, uh, who else do I see that will give me a fictional character? Princess Tiana for the song and the food, absolutely. And also, she was always really good with anything that she did. I felt like she could just change the world if she wanted to. And let's see what's food. Belle from Beauty. It's a lot of Disney characters in here. So I'm wondering if we have more of our attendees that would like to switch lives with someone. So thank you all for doing that. As you continue to come in, please introduce yourselves and let us know what fictional character you would swap with. So let's get started. Next slide, please. All right, first up, we have our community partner spotlight, and I'm going to pass it over to Shantini and Stephanie. Shantini, you're on mute.
Good morning, and sorry about that. We are super excited to be here. Thank you, Natalie, for opening this space for us to be able to share and learn more about the Virginia Community Health Worker Association and community health worker role in the Commonwealth of Virginia. So I would like to pass the baton to Stephanie Carrington, as she will start us off with the presentation.
Good morning, everyone. So thank you guys for having us. Here at the Virginia Community Health Worker, our mission is we're a space for community health workers to network and grow professionally and personally through education and advocacy. And our vision at the Virginia Community Health Worker Association is we will see Virginia communities having better health outcomes so that individuals and families can live healthier and happier lives. Next slide, please. So this is our leadership team. I myself am the board president, and to the right of me is our wonderful executive director, Shantini Jackson. Next, please. Community health workers. Shantini, I'll pass it on to you to talk about the landscape of community health workers.
Absolutely. So when you think about a landscape, we start thinking about the features, the aesthetics, the land, if it's in rural communities. So that technically is what we will do today. We will have a 360 view of the area in which we are focusing on, which today will be community health worker as a profession, and he will give us an overview of that role and perspective. So next slide, please. Stephanie.
So we have a fun fact. So everybody can get back in their chats. We're going to get you guys to interact with us a little bit today. The Bureau of Labor Statistics introduced the CHW Standard Occupational Code, the SOC code, in a specific year. What year was that? So if you could guess, everyone, I'm going to give you about 30 seconds to get in the chat and guess what year we received our occupational code.
And I could help with looking at the chat. If
Okay.
1971, we got one. Any more feedback?
Any more guesses?
Oh, 2000.
2000. It was a good year.
1977. All right. So
I still see a few more. 96 just popped in. So, I'm gonna tell you. We received our standard occupational code in 2009. So we're a little younger than our code is a little younger than that, but we've been around for a while as community health workers. In 2009, the APA defined CHWs as frontline public health workers. CHWs have trusted relationships with communities and are able to connect and be a bridge for communities and the partnerships. Next slide, please. The employment of community health workers by the state. This was from May of 2022. As you can see, the employees that have claimed this code in Virginia was 1,290. That was in Virginia in 2022. And the annual mean average was 51,370. So if you can look all over the United States, and this is from 2022, the information we received, but there are many more because there are a lot of community health workers and promotores de salud that are unpaid, volunteers. Next slide, please.
and just to add to that, they could be part-time. So the numbers that the Bureau of Labor Statistics report is only based on full-time employment. So those who are contracted, those who work part-time, or those who work as volunteers, as Stephanie alluded or mentioned, is not documented. So thank you so much. Sorry.
Thank you, Anthony, for adding that because that's very important. Where can I find CHWs? One might ask. Next, please. CHWs are found in many different settings, from hospitals, public health departments, community-based organizations, whether it's the frequently qualified healthcare centers, private, faith-based, managed care organizations. Next slide, please.
Great.
There is data that shows, next slide, please.
Yes.
There are data that shows that CHWs reported affiliations to, again, these places. So all of these are listed from Centera, which is the MCO, EVMS, VCU, local health departments, United Way, PAPS, IPHI, Divine Truth Ministries, La Casa de Salud, Centera of Rockingham, and many more, as you can see. They also are affiliated with things such as Cumberland, the YMCA, Nurture, Healing Hands, Valley. See, I'm not going to read them all to you because you see them, but so many places. There, Danville Life Saving Crew, Piedmont Seniors, Augusta Medical Center. There's CHWs reporting to many places. The next slide, please. Here are some other ones, some of maybe larger organizations that you may have heard of, from Sacred Heart, Bon Secours, Con, Mental Health, and many more. Birth Sisters of Charlottesville, RBHA. Next, please. They also reported affiliations to these places: Norfolk Community Service Board, Urban Baby Beginnings, Minority Health Consortium, Martinsville Coalition, the Portsmouth Behavioral Health, Ballard Health, Gateway, Ministry of Health, University of Virginia, the Latino Health, the Carilion. Next, please. As you can see, CHWs have reported to numerous places. And they work at numerous places. These are the latest that were reported. Which 3 counties in Virginia have the most certified community health workers, or CCHWSs? This information is based on the data from the Virginia Certification Board. So I'm going to give you a couple seconds to place that in the chat. Which 3 counties do you believe have the most CHW certified? All right, I see Richmond, Fairfax, Lynchburg, Henrico, Chesterfield. Thank you for your guesses. And so next, I don't believe I live. Okay, the CHWs who have the most. I might need some help, but I believe it was Norfolk, then Richmond, Chantilly. I believe I need your help. Norfolk had the most. Richmond, and then Chantilly. I will bring you back the answers. Um, we also, the Virginia Certification Board is an authorized certification entity. At the Virginia Certification Board, can you go next? We worked with them over the years and were able to come up with a plan to get CHW certified. And so the employer count, again, right now, with the most employees in the state of Virginia is Norfolk. And then by county, Norfolk has the most, and then Richmond. And then I believe right behind those is Danville and Henrico. Next slide, please. And we also have community health worker support services. Community health workers' core area of services is our outreach, navigation, education, advocacy, and relatedness. Again, remember that CHWs have to have some sort of relatedness with community health, with their community that they serve. Next, please. Services traditionally offered to Medicaid members are emotional and cultural support, from home visits and language support, coordination and medical behavior services are offered to Medicaid members. Navigation of health and social services, maternal, child, and family health and wellness, health promotion, and injury prevention. All these services are traditionally offered to Medicaid members, but there is a good chance that some of the members won't know how to navigate the services to get the things that they have or won't know that they're there. So CHWs are there to help them navigate and connect with it and, help them out with those. Next, please. We focus on relationships, community, and resources. Next. These are some pictures of community health workers in the Richmond City Health District Community Health Worker Program. Specifically speaking on this picture, this is with Shalom Farms. This is in the public housing area, and you see a couple of our residents shopping for vegetables, and some of them did not trust it. So we were able to connect them and build a relationship with the farmers market and the community members so that they could purchase the vegetables, learn, ask questions, and now we have many residents who are eating many fresh organic produce and understand that they can afford it with their benefits that they're receiving. Next.
I
That was
will take
exciting.
the next slide because
Thank
that's
you,
my
Shantini.
community. So this is just an illustration, and it brings back everything that we've been talking about. We talked about the core competencies that community health worker embody, which are closely tied and intimately tied to communities. On the left, you will see a picture of a manager, the manager of the privately owned low income public housing. I was one of the spearheading team members for this specific resource center. And it came about due to a pain point or an issue that we were experiencing or community members were experiencing related to navigation, access to resources, and the low attendance or the low number of attendance that we have seen. So, in other words, what we did is that we coordinated efforts with a local apartment community to bring about services to communities to reach them where they were. But we did not do this by ourselves. We actually were able to connect at this event, particular event, more than 300 people. We had more than 50 vendors and definitely a dedicated team of partners, city and state government, as you can see on the picture on the right. Next slide, please. And so, in terms of partnership, again, the proverb of it takes a village is a reality. So the partnership on the right is with Anthem during the pandemic, in which they provided support through a stationary hand sanitizer. As you can see, Giselle and Rebecca are amazing public health nurse. On the left, you see a partnership with the local YMCA where Adam and the team delivered boxes of food to members of this community. Next slide. So this is a picture in which we partner with Walmart. They donated unrestricted funds for community events. They supported, in this particular case, our annual barbecue, where again, more than 300 people were able to be connected to resources, information, and services in order to support their needs. And it was not catered to a specific program. It was open to the needs of that particular community. So next slide, it's important to keep that in mind. And so here you will see a faith-based organization and a nonprofit who came to Southwood to trailblaze and support the needs of those communities. Needs related to food, needs related to clothing. So we are grateful for the experiences and partnerships. Obviously, the association is led by industry professionals who are committed to serving, developing, and building communities through education and equitable public health. One of the things that we are very proud of is that we provide technical assistance to organizations and individuals, training for community health workers, doulas, well, that's in the process, and professional development to community health workers. And the last 4 points is that we want for community health workers, as mentioned in the mission, to have a space where community health workers can network safely, can find employment opportunities, can engage in social activities, but more so with the support and partnership of members, corporate members, through either membership or sponsorship. So we are extremely thankful for this time, and thank you so much, Natalie, and the rest of you who are here for taking your time to hear our presentation.
Well, thank you so much. It is always wonderful to hear from directly from our partners about all the work that they're doing and all of the engagement that's taking place within the community. I encourage any of our attendees to drop a question. I know off bat, I definitely have one. You know, one of the beautiful things I think that exists with community health workers and the entire network and the wonderful relationship building that you do. Could you really describe your approach to building relationships and trust with our community members as they're navigating our health systems and anything in the health care ecosystem? You're on mute, Shantini.
Sorry, I'll pass it on to Stephanie so that she can share her perspective, and then I'll build upon that if that's okay.
Sounds perfect.
I think transparency and actually going through some of the ideas or the same things that they're going through works, and being transparent about it. I myself have had Medicaid for my children, so I understood all the complications of it, of not having to do certain things, or I myself have built relationships with certain workers in the social services department, and trying to pull their legs about certain things. So I just think having those relationships and going through it yourself, so being able to empathize with them and tell them what you're going through, giving them honest answers about everything, so that's what I've done to help me on that side. And I'll pass it on to Shantini.
Thank you, Stephanie. Absolutely. Lived experience is a key aspect of building trust, but also that connection. So if I can identify and connect with that culture, whether it is geographic, so I lived in that zone, or I know the history of that community. If it's linguistic, whether I
Right.
speak English, Spanish, or whatever other language, then I'm able to connect. Because I usually use this example when I go to Stephanie's community. Sometimes what they see is my skin color, which is okay. That's a good observation. That's great. But when I speak, that's where they are like, oh, where are you from? And so that creates that actual live connection, right? Because the visual connection was there, but the linguistic connection might be something that we may need to explore because it's something that we as human beings can adapt. And that's the beauty of everything. But again, it lies on the relationship, it lies on the identity and representation, which are key elements on the APHA definition of community health worker, right? So we are frontline public health workers with trusting relationships that are based primarily due to that extreme or on traditional relationship that we have with that community that creates bridges for navigation, for education, and for all the aspects of social wellness that and health wellness that our communities need. And just that's my 1 or 2 cents in terms of that. Thank you. Great question.
You're welcome. And one last follow-up question. We have lots of our providers, health professionals, a lot of different people, community stakeholders, as well as advocates that attend these meetings and so many others. And there's so much information that we have to cipher through and that you all have to then translate and connect with our members. How do you stay informed about the new developments in public health and healthcare policy? What training or other avenues in order to get this information outside of attending wonderful meetings like this? How do you stay abreast of all of those things?
So I'll start and then I'll pass it back to my colleague. So normally we are very connected with the national effort. So the National CHW Association is one of our pouring organizations that we are intensively connected to or intrinsically connected to. Another way in which we stay up to date has to do with our regional association meetings or networks. So the leaders from associations in the southeastern part of the country have come together to create a space, an incubator space too, where we could talk about issues, we would talk about priorities, we could talk about lesson learns that bring us together and move us together to the place in which we can collaborate, we can elevate and activate much more of these values and language and policies and initiatives that are going to sustain and elevate the work that we're doing. And lastly, obviously conferences, right? That's the default way to go. And so I will pass it to Stephanie.
So with me, I would say Shantini answered most of that, but we also go to different trainings with different um, Medicaid trainings, many of the MCO providers. We follow different policies. We are really in tune to what's happening at the state legislation level, and we are doing our best, and I guess purposely putting a foot forward to stay informed of what's happening locally. Again, as I said, trying to connect with different social services agencies, and figuring out, hey, what's happening? Hey, and with especially with the Medicaid side and trying to figure out, because there's a lot. Every time we have your big book, we learn a new page. And so I'm glad you asked that question, because it's as hard as it is for us. And imagine life when you don't have 40 hours to think about this or to do this. So CHFs are really a really important part of trying to get the word out to those who don't have time to look into it.
Well, I thank you both. I hope you'll stick around until the end, just in case some more questions come your way. As you can see on the screen, that is their website. This is both of their email contacts. They hopefully will be around through the end of the meeting. And if you have any questions or follow-up, please do not hesitate to reach out to them. I have found that Stephanie and Shantini are always open and welcoming, and they always love to not only share the story of community health workers, but share the story of those members who have been impacted by their services. So thank you all both for being here. Next
Thank you
slide,
for having
please.
us.
Thank you. All right, next we have up Sarah, and she is going to be presenting what is a new policy. Thanks, Sarah.
Yeah, hello again, everyone. So I'm going to talk about the new 12-month, what we call continuous coverage or continuous eligibility for children. Natalie, you can go to the next slide. I really just have the one with the content, but for a bit of background, the federal government kind of mid last year put this requirement into place, saying that by January 1st of 2024, so a month and a half ago, all states would be required to provide 12-month continuous coverage to children enrolled in Medicaid and CHIP. And CHIP is just our famous program in Virginia. We just have a different name for it. There are some exceptions in place, but before I get to the exceptions, what continuous coverage means, it is exactly what it sounds like. It means that once that child is enrolled, they get a 12-month period during which their coverage should not be terminated or reduced. So a reduction in coverage, for example, would be moving a child from a Medicaid into the FAMUS program, because FAMUS has, or Medicaid has a few additional benefits that FAMUS does not cover. So that would be considered a reduction, or moving a full benefit child into a limited benefit program, such as like a medically needy group. And so they have to stay where they are, or they could be moved into a little bit more robust. So someone could be moved from FAMUS to Medicaid, because Medicaid is a more robust level of coverage during that period. There are the exceptions, which are turning 19. So when someone turns 19, it means that they are no longer eligible in the children's category of Medicaid. And so we would go through the regular process that we were always doing, with the exception of the public health emergency when nothing was regular. Or when a child turns 19, we, as the state, look to see if they're eligible in an adult category of coverage. And if they are, we move them into that coverage. And if not, we, follow the process of setting the renewal and getting the information that we need. And if they're no longer eligible, ending their Medicaid at the end of the month in which they turn 19. If a member moves out of state, a child moves out of state. So all Medicaid programs are part federal, part state funded and run, and every state has slightly different kind of nuances. And so each state will only cover the individuals who are residents of their state, understandably. So if there is a permanent move, and again, a child who's temporarily out of state for school or for something like that, that's not considered a permanent move. This is talking about individuals, children who are permanently moving from Virginia will have their Virginia coverage ended. If someone requests that their coverage ends, I know it says member here, and like a child isn't going to call and ask for their coverage to end. That's just the way the federal rule is written. But if the parent requests that coverage is maybe ended, maybe they've gotten a job and they just want everyone on the employer coverage. Obviously, we always respect the wishes of the family, the guardians, when they make that request. If it was found that there was an error of fraud with the initial enrollment, so we went back in and the family forgot to report the third job that they have, and all of a sudden we're like, oh, well, we enrolled you in error. We didn't have that information. or the worker made an error, didn't look at something properly, and that was discovered. That could result in the coverage ending before the end of the 12th month. And then if a member passes away, obviously their coverage would be ended as well. So what doesn't result in a termination of coverage? Anything not on this list. So that is a much, much longer list. Prior to this, if a family called, they had enrolled their kids, they had enrolled themselves, and then they got a new job and the income went up, and they had been in coverage for 6 months. They'd call, report that income change, and everyone would lose coverage if they were then over the income limit for Medicaid or FAMAS. Now, the adults may still lose coverage at that point because this protection is not, conveyed to the adults in the household. So we do definitely still want people to call and report their changes, but they shouldn't impact the child's coverage until the end of the 12-month period. What may happen is if someone calls and reports a reduction in income, again, that child may be able to be moved from FAMAS to Medicaid at that point and given kind of a new 12-month period. But again, we're not taking anything away. Other things, obtaining other coverage. So children in FAMAS do have to be uninsured. They cannot have other coverage. Children in Medicaid can, but if you are in FAMAS, you cannot. So if a child gained health coverage during that 12-month period previously, and they were only eligible in the FAMAS category, which is a slightly higher income level than Medicaid, their FAMAS coverage would be ended. Now again, we still want to report it because we still want to have an accurate picture of the household situation, but that coverage would, again, the FAMAS would continue until the end of the 12th month. So what happens at the end of the 12th month, right? Or when does this 12 months begin, right? Lots of good questions. So the 12-month period begins when the child is either enrolled or if a renewal occurs. And so I've been enrolled for 12 months. What happens then? Well, 2 months before that, the state kind of starts the renewal process. And I know we've all talked a lot about renewals during unwinding, but I'll go over it one more time. The renewal process starts as the state tries to just use the information they have to automatically renew that child and their coverage. We call this an ex parte renewal. If we have enough information through our electronic sources to do that, the family just gets a notice that says your coverage has been renewed. Please remember to reach out to us if anything changes. You're good to go for the next year. And that child then, gets another 12 months of coverage. If the state does not have enough information, maybe that other insurance was reported 6 months ago, but we're not sure if it's still in place or not, we send a renewal form. So that kind of long renewal package gets mailed to the family, and that needs to be completed and returned still. So if that is completed and returned and the information indicates that child is still eligible, again, they'll be renewed and get another 12-month coverage. If that packet is returned and that FAMAS and eligible child still has that other coverage, then that FAMAS will be ended at the end of that 12-month period. And if that packet is not returned, so the state does not get back the information that they need to determine if that child is still eligible, then that's what we call a procedural closure. So that coverage will end because we couldn't make a determination. The information was not available to the worker. In that case, there is this 90-day period after that closure where that renewal can still be returned. And if that child is found to be still eligible, we'll re-enroll them back to the end date, and they'll get, again, 12 months from there. And so that's kind of the big change for kids, or helping our kids stay covered, and hopefully helping our families having a little bit less churn and turmoil with that coverage. And again, just want to highlight, we do want to know about changes, especially moves. If that renewal package is sent to an old address, you're not going to get it. And then they don't return it, and then the coverage is terminated. You go to pick up a prescription, or you go to your doctor for your child's well visit, and they're like, we can't see you today. Your Medicaid's ended. So please make sure those contact information details are reported and any other changes are, so that, again, that also makes it way more likely that ex parte process will be successful if we have information that is the most up-to-date and aligns with your current situation. Then those automatic renewals are more likely to be successful. And that's really just a much simpler process for everyone involved.
Thank you, Sarah. We did have one
Yeah.
clarifying question, which was, well, statement, a request, either way. Could you explain one more time when that 12-month continuous coverage starts for the child, or if and if anything needs to be done on behalf of the worker or the parent in order for it to start?
So for a new applicant, the coverage will begin the day that the enrollment begins. With Medicaid, your coverage begins the first of the month that you apply once you've been approved. So if I applied today, there's a chance my application wouldn't be kind of finished going through the process until next month. Maybe I would get my notice next month, but my coverage goes back to the first of the month that I applied. So my coverage go back to February 1. And then February would be my month 1. So I would have 12 months of continuous coverage from February till January of next year. And then, so I have a January renewal date, right? Like the state has to review my coverage and see if I'm still eligible or not by the end of January. So say they do, and they say, yep, you're still eligible. Great. We're going to give you another 12-month coverage period. That begins the month after the 12th month of my current period. So my second 12-month period would begin next February, assuming my renewal was effective. Kids who are enrolled as of January 1, so say January 1st, 2024, is my 6th month of coverage, right? I applied last year and got enrolled. And so that would mean in July. So I had 5 months of coverage last year. If I'm enrolled as of January 1, I am protected for the remainder of that period. So from January 1 forward, I get continuous coverage. And then when I get renewed, I would get a full 12 months because the protection didn't go into place until January 1. So it applied as of that date, even for folks who had already been covered, but just for the remainder of that 12-month period. And then again, if they're still eligible, get a whole new 12-month period where they would get the protection for that full time frame, so long as an exception isn't met.
All right. Well, that was the only really clarifying questions that came through. Is there anything else that you would like them to know regarding where to access any resources or additional information regarding this 12-month continuous coverage for children?
Yeah, you can absolutely go to the Cover Virginia website that gives you information. It also has flyers that you can print or order. So if folks are amazing community health workers, want to help get some information out to the members, the individuals that they're working with, they can go there and get those resources, or just read up and make sure you've got all the details down. You can always reach out to us. Natalie has the information up there. Good timing, Natalie. Thank you. And the local DSS office, if someone does need to apply, the continuous coverage kind of is just automatic. You don't need to like check an extra box on the application or anything. It just is in place. It just, covers. So if a child if you're curious about the eligibility for someone, Cover Virginia has a lot of that information. You can do an application at the Common Help website, at the Cover Virginia call center, which is 855-242-8282. Or at your local DSS will have paper applications that can be submitted there.
Excellent. Well, thank you for being with us today and explaining through one slide, which is quite impressive, all of the information that goes through the 12-month children's continuous coverage. Next slide, and hopefully you'll be able to stick around for the next few minutes, just in case we have more questions. All right, so as we wrap up, first of all, again, we want to thank our speakers for being here today. We know oftentimes when it comes to different coverage changes that Sarah explained earlier, that we depend on others in order to do that. And so we really want to thank them both, all three of them, for being here and talking through not just like what it would be for a policy change like we have here, but also what it would be like for someone in the community to also help us make sure that that policy change is reaching those who it affects and impacts. As we move forward, we'll be taking on different subject matters and different engagement areas, and we want to make sure we hear from you. If you ever have any suggestions or any feedback about the things that are shared or what you would like to hear, please do not hesitate to let us know. You can always reach us at covervirginia@dmas.virginia.gov. And if you have my contact information, you can always reach out directly to myself or anybody on the team. As we move forward and we continue to grow and learn about all the different areas and all the ways in which we try to support our community stakeholders, advocates, and anybody else that touch our members, including our members themselves, we want to make sure that you have that information. I also want to give a kudos out to our members in of itself. In January, we sent out a call for members to sign up to be a part of our Virginia Medicaid Member Advisory Committee, our MAC. And I know Dot is always just very excited in the background whenever we're able to hear this. But we have been able to fill our 4 seats for 2024. But we still encourage people to continue to apply and continue to learn about our MAC committee. And so we received over, I think, almost 500 applications, and we were able to go through them, but we continue to we wanted to continue to be able to learn and grow and mirror the members that we have across our state. So please do not ever discourage them for submitting their application. And we never know when we have a member that will no longer be able to serve, and we may have to fill a vacant slot. So we always encourage you to do that. Please take this QR code and look up the page on our website. We would love to learn a little bit more about that and about our members. Next slide, please. All right, these are topics that will be coming up over the next, over this year. If you don't see something and would like to hear a little bit more, we will be reaching out to these different areas in order to try to fill and gain speakers across all of them. If you have any ideas or any speaker suggestions, don't hesitate to send those as well. So this is what this looks like. So next slide, please. Thank you for being here today. We're going to give you back a few extra minutes of your day. This is where you can get in contact with us. This is where you can always find additional information. If you do have any subsequent questions, please don't hesitate to let us know. Thank you again for being here. Thank you for joining us. And we hope that you have an excellent and relaxing rest of the day and upcoming weekend. So have a great one, everyone. Thank you, Shantane. Thank you, Stephanie. Fantastic job. And thanks, Sarah.
Thank you so much.
Thank you for having us.
Absolutely. Thanks. Great presentation. This is Dot.
Thank you.
Thank you.
There was a comment from Donna. I just got it. Hopefully she was able to see it, but in case, one of her question had to do with supports for those who are in
Oh, she's still here.
Oh, okay. Living independently and needing navigation assistance in that process. And so I quickly responded, but I told her to email us in case she has more details.
Sounds good. Sounds good. Well, thank you both. Y'all have a wonderful day and stay warm on this chilly day.
Indeed. Thank you. Bye-bye.
Bye. Thanks, Sonia.